So we're going to record this so you can access this later if need be. So what I'd like to do is talk a little bit about who we are, why you will benefit from joining us on an executive MBA online in health specifically, the benefits for your career, so you can make the case to your employer and others, particularly the kind of profile of the student that we're attracting, and the practicalities of what the program actually looks like and applying for it in 2023, and various events that you can keep in touch with us in the meantime. So there is this saying that health is wealth. If you're healthy, you're economically likely to be more productive, and therefore you can make more wealth to look after patients and social health care for your economy. So we're very closely linked to the Sustainable Goal 3, which is about health and well-being. So we were founded over a year ago as a kind of startup in terms of the Global Business School Health and one of the top universities in the world. So we are the first business school in the world that's totally dedicated to educating future generations of health and healthcare management leaders. So we're at the cutting edge of looking at healthcare management, looking at what's been happening in the pandemic, what we need to keep doing or not do. And we really question the status quo. So there's a huge shortage of workers. There's a lot of problem about funding healthcare. So how can we equip you as EMBA students in management roles, in leadership positions, to tackle the status quo and to really make an impact in terms of public good in the health and social care sphere? So I completed my own MBA by doing it on weekends. But I've taught for the Open University for around 25 years now, which has been predominantly online. So I think it is hugely valuable if you're working in consulting and doing an EMBA at the same time, because you can reflect about your day job and improve your day job and your prospects while grappling with key concepts and case studies and practitioner input on your assignments. So Kim Clark, who was Dean of Harvard Business School, said medicine and business have long been intertwined. So today, with the extraordinary promise of emerging medical technologies, sweeping change in delivery of healthcare, and the push to control the costs of medications, the need for leaders firmly grounded in both fields has never been greater. So management and education is a growing area for employment and for entrepreneurship. And there was a World Health Organization report in 2019 entitled Delivered by Women, Led by Men. In most countries of the world, at most, you will find 20% of healthcare leadership roles filled by women. So there's a huge gap. If half the population is benefiting from healthcare, where are the women making the decisions in the boardroom? And often the curricula of dentists and doctors and clinical practitioners does not provide insights in how to manage and how to lead. So we're really filling this gap in bringing together the intersection of healthcare insights into the sector, as well as particular management expertise. So it's very much a cross-disciplinary approach. You will have medical and clinical professionals on the program, as well as people who have no clinical background at all, who are maybe working in health or want to work in health, but they have experience. So we often find hospitals are led by historians or social scientists. And clearly we want hybrid people who can speak the language of health, as well as people who can speak the language of government policy, entrepreneurship, investment banking, private equity that can support healthcare organizations. So what we do is equip you to speak multiple languages, if you like, of different stakeholders in the healthcare sector. So you can speak with strategy consultants, you can speak with civil servants and government ministers, as well as people on the ground. perhaps in primary care, in other sectors of health, pharmaceutical industry, for example. So you might like just to continue as you are. You're doing very well in your job. You're enjoying your job, and just learn on the job. But doing an MBA, particularly an EMBA in health, will accelerate your networking and your knowledge and your personal and professional development, and give you that kind of self-confidence to understand global healthcare systems in different parts of the world and your own, and be ambitious about not only consulting and generating innovative ideas, but actually implementing them on the ground through others. And it also gives you the opportunity to build various other aspects of your career. So you may be in full-time employment, you might want to start your own private business on the side, do some entrepreneurial activity or some consulting. So we equip you with those kind of skills. And we equip you to deal with working in the boardroom or working with people who are in the executive suite, who are making policy decisions and managing change. So I did a master's degree, a specialist master's, and then I did an MBA. And that kind of produces T-shaped leaders, because you've got the very generalist approach of an MBA. You can speak the language of finance, marketing, HR, but you've also got the kind of deep knowledge, perhaps, of a particular area. So with the EMBA, you can stay at work, you can stay with your family, you don't have to travel, you can learn fairly flexibly and earn at the same time. It allows you to specialize in a particular field and develop skills that all MBA students are expected to gain in a top UK university or top business school. So we're really developing your critical thinking skills, your soft skills like negotiations, emotional intelligence, negotiating with others in different cultures, and to build your credibility and confidence in different domains, across sectors and across disciplines, across management functions. So often MBAs attract people not in their early 20s, but people who've had some time out working in organizations, mid-career, later career, to kind of take stock of where they are and where they want to go. So we're looking kind of for you to reboot your careers. So UCL is a top university. It's 8th in the world. It's first in research in the UK. It's first for economics. It's first for medicine, health, and life sciences in the rankings that were published last week. And unlike London School of Economics or Imperial College, it is a fully comprehensive university. So you will meet psychologists, you will meet linguists, not just clinicians or not just social sciences. So that's a huge benefit. You'll meet people from other domains. So if you look at lots of MBAs that talk about health, often it's a standard MBA and they just add on the health bit. But we embed health all the way through. So our case studies, our academics, our executives in residence have experience in healthcare sector. And we use case studies, and you have field trips, and we embed our insights in the healthcare world. So we have current CEOs, former CEOs, management consultants in top consulting organizations who are actually implementing ideas on the ground and making change happen. So we have 30 executives in residence who you'll meet throughout the program, who can help you with career advice, mentoring. We have a recruitment agency working with you. So when we interview you, we'll note your particular career goals and make sure the program includes reference to your interests. You'll have access to alumni. So there are at least 40,000 alumni from UCL every year. So networking is a key element. Jeff Pfeffer at Stanford says, it's about who you know, not just what you know, and how you can deal politically with very senior people and policymakers. So the people we're looking to invite onto this program and offer places to normally have a good academic background or a clinical background. They have work experience, which may be either full-time or they've gained it in various placements and at university. They're people who are ambitious, who really do want to make an impact on the world, not just have good employment prospects for themselves. They may come from pharma, biotech, consulting, and they're very keen to share resources and insights with very geographically dispersed members of the cohort who will be their peers. And also the NHS, get to know the British system as well. So in terms of careers, clearly there are the big four consulting firms who are very interested themselves in the healthcare sector. Big pharma, biotech, Bupa, World Health Organization, NGOs, various companies like medtech, health tech, entrepreneurs. Perhaps you want to work in government or in academia. Data analytics, perhaps you are a medical doctor and you want to go further to be a medical director, or you want to form your own business. So our program is designed to expose you to all these different aspects for you to understand how these integrate and how you can work with people with quite different aspirations and interests from you in the sector. And it certainly is an important sector for the future. 10% of gross domestic product in many countries now is spent on healthcare. And clearly in the US, that's much higher. So your earning capacity and your employability in this sector clearly will be enhanced by going through the program. So we kick it off in September 23, towards the end of September, with induction beforehand. It's a 24-month program part-time. And you can come to London for 1 week in the first year, and we'll likely be going to the USA for a week in the second year. Tuition fee is $45,000, but there are quite generous scholarships, and you can apply for a range of scholarships at GBSH, at UCL, or more generally. So we realize people come to this program with different strengths and knowledge. So there may be gaps that you want to fill before you arrive. For instance, accounting and finance, understanding global healthcare systems, time management, study skills if you haven't studied for a while. So we give you materials that you can access before you arrive. Personality questionnaires, assessments 360, emotional intelligence questionnaires. The main difference between doing an MSc and an EMBA or an MBA is that it's very much about your career development as well as learning content. So career conversations are built in throughout how we can develop you as a professional. So we have 4 teaching blocks of 8 weeks each. So you'll have 2 weeks for strategy, 2 weeks for people, 2 weeks for marketing, 2 weeks for wrap up, and then you'll have an assessment. The second term, 2 weeks finance, 2 weeks economics, 2 weeks data analysis, a wrap up, then the assessment. Then you can come to London. Then we have the following year, we have executive leadership for 4 weeks in the first term. Then we go to the US for a week, and then we have another, 8 weeks. Each of these blocks is 8 weeks, an 8-week block of contemporary topics in healthcare management, such as digital innovation and change. So we'll have real life case studies, interactive learning. And in addition to these 4 8-week blocks and the 2 in-person study weeks, we have 2 projects going on in the first year and the second year. So the second year, you'll have this group project working on a project together. And in the first year, you'll also have an individual consulting project. So these are to develop your consulting skills and to get you ready for the next step in your career. So either we have a choice of projects or you can choose your own and ask us for help in that project management. So as I said earlier, all the people recruiting are ambitious to make a difference. They have other things in their lives too. They're working and maybe have families, traveling and so on. But they do want to get to the next level, maybe in public healthcare, the private sector, charities, and they have some work experience, even if it's not in health and they want to pivot into health. So one example I give is Sir Patrick Vallance, who is a medical doctor who was head of UCL Medical School. He worked in Glaxo, on the board of Glaxo for a while, and he was very key in working with Boris Johnson and civil servants to get the vaccine through in the UK. So he's one of those people who can speak multiple language in different occupational groups. And that's the kind of student we're looking to produce from this program. So what we're looking for when we're deciding who to recruit, ideally we're looking for a UK minimum equivalent of an upper second class degree, so a 2-1 degree or an overseas equivalent. If you don't have that, but you have extensive work experience, it is possible to offset that if you don't have a 2-1. The UCL requirement, which cannot be changed, is that you have an IELTS that you've obtained in the last 2 years that is at level 7 or above, and no area is less than 6.5 in the individual tests. Ideally, you've worked for about 5 years. Many people who apply for EMBAs and MBAs complete the GMAT score, and we're looking for around 600, but we're looking at a balanced GMAT. And if you have extensive experience, particularly as a physician, and have done lots of exams in the past, you can request to waive that. Everybody we invite on the program has been interviewed by 2 people, so we have about 20 minutes online checking to see if you're a good fit with us and to give you the opportunity whether you would like to join us. And we also assess your personal statement and 2 references. So the GMAT links are here. You can take your GMAT as many times as you like, and you just send us the highest score. And if you are going to apply, it's very useful for you to take note of these questions, because this is what we will ask you at interview. So we'll ask you about your journey, where you've been, where you are now. We'll ask you why you particularly want to do a specialist EMBA in health, what makes you special, what you can contribute to the cohort, what you're expecting from us, some kind of self-analysis, what are your strengths, what are your areas for development, and then finally where you might like to be, in 2028, 29, 2030. Do you have some kind of overarching career goals that we can help you with? There are some scholarships. There's a Future Impact Leader Scholarship of 1/3 of the tuition fee. There's a Women's Leaders Scholarship too, of £5,000. And there's also an East London Healthcare Leaders Scholarship. So you could apply for all of them depending on your eligibility criteria. There's also Achievening. Obviously, if you live in India, there are different scholarships in different parts of the world, and postgraduate student loans. So some people have 3 or 4 kind of ways of funding. And you can also, even if you're not from the UK and you have a visa, you can work 20 hours a week. So clearly you can do other work if you happen to be, I guess that's not so appropriate for online learning, but certainly for the students who come to the UK, they do have the rights to work. But what I'm saying is that, you can do other things and have breaks and flexibility in the timing to bring in funding yourself. So the onboarding, as I said, is a primer package. We have very supportive induction processes, and we will have 360-degree appraisals throughout the year. So you give feedback to your fellow students and they give feedback to you, and so to your tutor, two-way. We like a lot of interaction and feedback. And there's a lot of support. So there's over 250 clubs and students' union activities. There's mental health and well-being support and counselling from the student support and well-being team, as well as from the students' union. When you do come to London, you'll see Bloomsbury, you'll see us in the Olympic Park. It's a fantastic city, a very walkable city, very safe, inclusive city, and it was ranked #1 in the QS rankings by students last year. Lots of free things that you can do as well. And we'll confirm the US cities. It's most likely to be somewhere like Boston and then somewhere in Atlanta. Okay, and clearly September 23 is a while away now. So if you do want to start to get to know us, we have lots of interviews with interesting people on YouTube. We do happen to have a conference in person on the 27th of May with cosmetic surgeons, actually. People can come to that. We have an open day on the 1st of June at noon. We have another EMBA Health Open Day at noon on the 10th of June. Information about scholarships on the 15th. And we're regularly updating our events, programs on that link. And you're very welcome to join us and see what's going on generally. Okay, so I've done my slides. This is the last one. So if you do have any questions, you can write them in the Q&A at the bottom. You can email any of us at any time. And you can also have a very informal conversation with me. You can email me at julie.a.davies@ucl.ac.uk, and I'm very happy to chat quite openly with you. And then later, if you would like to apply and you're selected, we can interview you formally. And we have Twitter, Instagram, Facebook, and so on that you can follow us to see what we're up to in the meantime. Okay, so I hope that's given you a good picture of where we're at currently. Okay, so thank you very much, Jose, for your question. So beyond the format, what are the main differences between the MBA Health and the EMBA Health? Okay, so there is one particular content difference, and that is we have more leadership content on the EMBA. And clearly the visits on the full-time MBA, we have a 2-week visit in January, either to Riyadh, Lagos, or India. So we have longer study visits at one time, and we don't go to the US for that. And I guess the age, you know, in the EMBA, you're likely to have older students. So the kind of students we're getting on the MBA at the moment, we have about 8 doctors, we have 5 dentists, we have lawyers, marketeers, social workers, nurses, a whole range of backgrounds. And a lot of people actually from India, Saudi, Kuwait, Africa, a few people from the UK. So very geographically dispersed and very interesting backgrounds. China, investment banking, private equity, someone who has their own company. And some people have already completed a master's and want to do an MBA. So you will get very similar content, but you just get greater flexibility and perhaps more experienced colleagues. Okay, that's the only question I've had so far, so please feel free to write more in the chat. Any other questions you'd like to ask? You can see at the bottom there's a Q&A, feel free to write in it. Any more questions, anybody? Helen, I think we spoke the other day. Mamta, knee patients, please feel free to talk. You're very welcome. Can we have a second one here? Are travel expenses to the US included in the fees? No, that's a very good question. They aren't. So if you really can't join, it's not absolutely compulsory. You don't get marks for going to the US. We strongly encourage people to come, and we give people cheap options. If you want to stay in a very cheap accommodation, that's fine. We do pay on the ground once you're there, travel and meals, but not getting there. And similarly to London. So once you're here, actually I'm in Brussels today, but once you are in London, you don't have to worry about costs. We pay for travel and meals and so on, but you just have to get here, get to London. So I hope that's not a problem, because people are coming from all over the world. So, okay, any more questions? Jose, Mamta, Helen, knee patients? Thank you, Nihi. I mean, I guess if you book very far ahead, you can get cheap flights. Hopefully that will help you. Okay, I'll give one more minute, and if there aren't any questions, we'll finish today. Any more? Anything you'd like to say? Okay, so of course, it's a long time yet till September 23. So you've got time to explore scholarships. You've got time to come to some of our events, get to know us. We will be in the Olympic Park. So you can come to see us in the Olympic Park at some point. If you're traveling through London, do come and see us if you'd like to see us face to face before you commit. And do ask, actually. I got a scholarship. I've got 4 degrees. In fact, I've got 5 degrees and didn't pay for any one of them. There was a kind of women's scholarship for women in London at one point. I was the first person in my organization to ask for money for an MBA, and I got it. So be brave, look at our slides and see, the benefits in our brochure. So you can perhaps persuade your organization to sponsor you, perhaps a little bit at least, because after all, they will be getting, highly motivated individual, and maybe you can give some consulting back, and you will be more productive for your employer. So do make that ask if there's any possibility at all for someone helping you if you need funding. Okay, so we'll end it there. Do get in touch. It's nice to see some of you coming back again to our sessions. And we look forward, hopefully, to hearing from you, and hopefully one day seeing you in London if you want to join University College London. So we'll finish the recording now, and you can refer to this at your leisure.